I see patients in private practice of any age with foot and ankle conditions, and I also operate on patients at the Women's and Children's and Royal Adelaide hospitals. I operate on people who need foot and ankle surgery who are very young and also who are very old, and anywhere in between. There's not many surgeons in town who would have that full gamut of experience with operating on children's foot and ankle and then following them up into adult life. So I have the perspective of what might be needed at each age group. I'm from Adelaide originally. I've trained in Adelaide, London and Melbourne, and I have a vast experience in orthopaedic training. My main goal is to help people and make them better. And I think of all the medical specialties, orthopaedics does that, and it gives people back their quality of life. Surgery can be really daunting for people, and sometimes as surgeons, because we do it every day, it becomes very normalised. But I know that going into surgery is a very scary process for most people, and so I am very compassionate and get to know my patients so I can help them through that process. I always put myself in my patient's shoes. I try not to use medical jargon so that patients can understand what their condition is and what the treatment options are. I've also developed my website to have patient information and information sheets about surgery and what the rehab might involve, because I think education and knowledge is power, and the more empowered that patients feel, the better they'll feel through their surgical journey. I have the surgical expertise and experience to help patients with foot and ankle conditions, whether they be small children or adults, and I perform surgery for simple conditions or very complex deformities, and I'm really driven to give patients a better quality of life.